Hi, in this episode, we are going to talk about the topic of fertility from the Western medicine perspective. To join us here today to share more about this topic, I have here with me Dr. Janice Tung. Dr. Tung is a consultant ONG and IVF Specialist at Thomson Fertility Singapore. Thank you for being here with us today.
Hi Kelly, hello, thank you.
So Dr. Tung, what exactly is infertility and how is it defined?
Infertility is medically defined as the failure to conceive a pregnancy after 12 months of regular unprotected sexual intercourse. But that is just a medical definition. Infertility actually has a much broader range of implications that includes the psychological burden as well as the financial burden on the couple for assisted reproduction treatments, as well as the strain it puts on a relationship and even socio-economic impact on the society with regards to declining birth rates as well as an aging population.
Speaking of which then, how does our local infertility rates compare to that of a global statistics?
Infertility rate is about 1 in 6
here in Singapore.
Yes, in Singapore, which is comparable to developed nations of the world.
Now, what are the common causes of infertility then?
Okay, so in order to understand the causes of infertility, we first must understand how a pregnancy is conceived. So essentially, in a woman's natural cycle, they must be ovulating regularly and one egg must be produced and released each cycle, usually in the middle of the month. And then what happens after that is that the egg must go into the tube, and then this must be surrounded by a good concentration of sperm before fertilization can take place. And then after that, the fertilized egg, or what we call the embryo, must be able to travel along the tube and then go into the womb cavity and stick on it. That's called implantation. So anything that disrupts this pathway can cause infertility. So for instance, a lady can have a problem with ovulation. They can have structural issues with the womb, for instance, fibroids or polyps. These are growths that can affect the implantation. They can also have blocked tubes, which prevents the sperm from meeting the egg and the embryo from traveling, as well as the man can have low sperm count, so therefore they can't build up a good concentration of sperm around the egg for fertilization to take place.
Am I correct to say then that it is actually important to find out what is the cause of the infertility before options medically can be administered?
Yes, and it is important to detect these problems early enough so that there is time for treatment as well as time for trying after that. So the thing is, age is an overriding factor in all of these infertility causes. As you get older, you're more likely to have polyps, fibroids. As you get older, your egg quality and your sperm quality as well will be poorer, fertilization rates will be poorer, and outcome of the pregnancy, for instance, risk of miscarriages or the pregnancy landing up in a stillbirth will all increase. So therefore, age is extremely important and time is of the essence.
So speaking of which then, which means that age as the overriding factor, it applies to both men and women.
More so for the female, because the female, the egg is very large, is the largest cell in the body compared to the sperm, which is the smallest cell in the body. So the egg cell contains all the machinery in it to support the embryo growth. And in it, there's also the genetic integrity. The egg is born with us, so it ages with us. Whereas the sperm is continuously produced every day, there's new sperm generated. So therefore their genetic integrity is better. So the impact is more significant on the female side than the male side. But there will be a decrease in sperm quality after the age of 40 just from the fact that the machinery, the testis that produces the sperm is aging.
So Dr. Tung, you mentioned that our eggs are born with us and it means that our eggs are finite in our lifetime. Does that mean that as we grow older, our eggs also age and decline and decrease in quality?
Yes, that's right. So both egg count and quality will drop with age. In fact, the best years are usually 26 to 28 years of age, and then after that it will continue to decrease with and then finally reach menopause where it's 0. So this is the issue. A lot of people believe, or rather they have this misconception that there's an age threshold or a cutoff where, for instance, 35. Above 35, we are bad. Below 35, we are still good. But that is not true. It is actually a gradual and continuous decrease, especially if you're over 30. So the thing is, time in age is vital, and the time pressures that a woman face may be different from that of her peers the same age. This is because sometimes what happens is that some ladies, they start off with a lower baseline in their egg count. They are nearer to menopause than their peers, and therefore their time pressures is actually much higher. And also some young ladies actually have a genetic issue with their egg quality, and this they wouldn't know until, for instance, they embark on their first IVF or elective egg freezing, and then you will be able to see the eggs and assess the quality and the abnormalities. So therefore, it is an assumption if you use age alone as a cutoff for how good your egg count or egg quality is.